Hello, everyone, and thank you for joining us today. My name is Brenda DeLauder, Vice President, Marketing and Communications with United Way Halton and Hamilton, and we are thrilled that you can join us. It has been 2 years since our lives and our communities were upended in ways we could have never imagined. It's been 2 years of hardship, sacrifice, fear, and exhaustion for many. Older adults living in long-term care homes continue to face isolations due to lockdowns. Those older adults living independently still face limitations, with some including their ability to connect with family, socialize, attend community programs, or volunteer. Everyone deserves access to benefits, to programs, and to supports so that they can live in dignity. And with older adults being disproportionately affected, we need to pay special attention. During the next hour, we will be showcasing a new resource, a booklet called Caring for Community Resource Guide. This resource has been specifically designed to support older adults and their caregivers, and is available both in print and virtually online, digitally. If you haven't received a copy, you will find a link in the chat box to this tool. Today, you will hear from experts on some of the topics that are featured in the booklet, including frauds, scams, community resources, and deprescribing. So let's get started. First, just a few housekeeping items. If you need any technical assistance, please use the chat function, which you see at the bottom of your screen, to contact anyone with tech in front of their name. If you have questions for panelists, we hope that you will. Please use the Q&A function also at the bottom of the screen. Closed captioning is available along the same toolbar and can be changed in the settings. I want to start with why we are coming together today. We are gathered here to share knowledge and learn from one another, which held great importance in many Indigenous nations' practices. It is critical to recognize the impact Indigenous peoples' stewardship of the land has on our community as we see it today. United Way, Halton and Hamilton is situated upon the traditional territories of the Erie Neutral Huron-Wendat, the Mississaugas of the Credit First Nation, and the Haudenosaunee Six Nations. The territory is mutually covered by the Dish with One Spoon Wampum Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and other allied nations to peaceably share and care for the resources around the Great Lakes. This land is home to many Indigenous peoples today, and we are grateful to live, to work, and to play in the spirit of the Dish with One Spoon. I would now like to welcome Joanne Webb to share a blessing. Joanne was born and raised on the Bay and Simcoe Streets in Hamilton. She was a hospital worker for 32 years with CUPE 7800. She has represented Indigenous workers as diversity vice presidents for both CUPE Ontario and the Ontario Federation of Labour. She is also a former Workers' Arts and Heritage Centre board member. She is now retired, but still active, serving on the boards of the Hamilton Regional Native Centre and Sacajawea, a Native Housing Center. And we are blessed to have Joanne on the Retired Labor Leader Volunteer Council that created the booklet that we are learning about today. Joanne.
Ani, Bozu, Omaga Onago, Nadishakas, Hamilton Nadojaba, Mississauga Nada. My traditional name is a Leader of Stars. I live in Hamilton and my nation is Mississauga. You will know me as Joanne Webb. The building of a community is entirely dependent on the gifts that each member receives from the Creator and how these gifts are used. Consider your actions or your inactions and how will it affect the community or the world. Have the wisdom to know what decisions to make. One spirit will grow weak if not fulfilling its use. May we ask the Creator to help us along the way. And may we also ask the Creator to look after all the people in the world are in dire straits. I say Chimikwich, and let's have a good webinar. Thank you.
Thank you so much, Joanne, for opening our session and sharing your wisdom. We are grateful. United Way Halton and Hamilton, in partnership with the Retired Labor Leader Volunteer Council, was awarded the New Horizons Seniors Grant in early March of 2021. The project aimed to create a guide on aging in our community during a global pandemic. The council saw that there were gaps in the community for those who may not have had access to the internet. And we were thrilled to create and share a resource to support older adults. Along with the resource guide, there is a supplementary booklet for individuals of all ages to keep track of important personal information to be shared with trusted sources. The guide contains countless tips and advice on navigating social supports, information regarding aging, and personal reflections from community members on navigating the pandemic and beyond. Today, we are here to highlight just some of the topics covered throughout the resource guide and encourage community members to request printed copies and view the digital copies. Both links to the online versions will be shared in the chat below and can be found on our website at uwhh.ca. Thank you to the Government of Canada for supporting the development of this booklet through the New Horizons Seniors Program. We are delighted to have with us today an incredible group of local community members. Kamei Gagnon, Doctor of Pharmacy, Assistant Director of the Canadian Deprescribing Network. Adrienne Vickery, Customer Colleague and Strategic Initiatives, North American Fraud Operations, TD Bank. And Shauna Mutton, Vice President, Community Impact of United Way, Halton and Hamilton. So let's get started. I would now like to welcome Kamei Gagnon to the screen. She is a clinical pharmacist, has experience in primary care, program management, community pharmacy, and teaching pharmacy students and technicians. She is passionate medication safety advocate, and cherishes every opportunity to share her knowledge and passion with others. Kamei, welcome. Please tell us.
Thank you so much.
It's so great to have you here. Please tell us what deprescribing is and how critical it is to speak with your healthcare provider about what medications you may be taking.
Yeah, thank you so much, Brenda, and thank you. We're so grateful for this opportunity to share this essential information as part of this resource booklet. And I'm here today to kind of really put emphasis on what you'll find in the booklet, how you could use that information and why it's so important. And the title of the talk says it all. So what is deprescribing? We're definitely going to cover that and how it can help you really in the next years ahead, or help someone you take care of. It really is to make sure your medication is helping you. So let's dive in. So to start off, why do we take medications? As a pharmacist, I can name so many patients, people that I know medications have helped. They are necessary for health, and behind why today in Canada, one of the main reasons why today we live longer than ever. They help manage chronic conditions like diabetes, high blood pressure, conditions that a lot of Canadians suffer from. And they also, with these chronic conditions, help prevent complications. They also help improve symptoms. So I don't need to tell you, if you've ever suffered from a toothache or back pain, how just relieving pain or just a simple headache can help you just move on with your day. So medications help us in so many ways. So why am I here today? Why all the fuss about medications? Why am I here to talk about deprescribing? Well, really, the thing is that we notice, and we know when we look at numbers, that older adults take more medications than the rest of the population on average. With time, we tend to accumulate health conditions, chronic conditions, and tend to take more and more medications. And the issue with that is, as our body changes, the benefits and the risks of medication also changes. And actually what we're observing is that a lot of older adults suffer from what we call medication overload, or polypharmacy is the other more scientific way of saying it. But medication overload says it very well. It means taking a combination of medications that does more harm than good. And as a pharmacist, that's really not what I'm aiming for. When we treat our patients, we're really hoping that the medications they take are helping them. But unfortunately, we know that a lot of older adults in Canada actually suffer from harmful effects of medications, and those can be quite severe. Things like drug interactions or harmful effects of medication can impact older adults and cause falls and fractures, memory issues, or even hospitalizations and deaths. So the impact of the harmful effects of medication is very important on the older adult population specifically. Now, I'm telling you about overuse of medication or using the wrong combination of medication, how it can have an impact. But we also have to know that experts have identified some specific medications as being risky for older adults. So they should, in most cases, not be used, or we should use other options to instead to treat health conditions. But the issue is that we also know that a lot of older Canadians use risky medications. It's actually 1/3 of women and 42% of men. So the booklet, what it's all about is helping you as a patient, as a caregiver, as working with a health professional, as a policymaker, who knows, what can we do to prevent harmful effects of medication and tackle medication overload? Well, the answer is, together we can consider deprescribing. This is what it is. To answer your question, Brenda, what is deprescribing? It's a long word to say, really, it's the opposite of prescribing. It means reducing or stopping medications that may not be beneficial or that may be causing harm. The goal of deprescribing really is to maintain or improve quality of life. And really putting emphasis here, it always has to be done as a team. No one has to stop a medication by themselves. That can be risky and cause other issues. So really, you have to consult a doctor, your nurse or pharmacist, and do this together to get the benefits of deprescribing, to make sure you're doing this the right way, because some medications should not be stopped abruptly or should not be stopped at all. So how can you access deprescribing? Well, the way to go is to book a special appointment with your doctor, your pharmacist, or nurse, and to ask about deprescribing. And in Ontario, there is the MedsCheck program so every community pharmacy offers these services. Anyone with a OHIP health card is covered for these services if they take 3 or more medications for chronic conditions. So that's an easy way to go to access your community pharmacist, but you can also ask your doctor or nurse practitioner, any health professional really you would trust. Now, included in the resource guide is a list of questions to ask your doctor, nurse, or pharmacist to really evaluate if deprescribing is for you. So I'll invite you to consult these pages in the booklet. It's 46 and 47. You'll find them, it's in there. And to prepare your appointment with the health professional by asking yourself if you know the answers to these questions. And if not, well, maybe it's worth asking. Things like, can my medication affect my memory or cause me to fall? Can I stop or reduce the dose of a or some of my medication? And how do I follow up, and with whom? So this is all included in the booklet. So spread the word about deprescribing, about helping others around you tackle medication overload or polypharmacy together. We could do this together. And I'm so thrilled to be able to present these resources. Our website's there, and that's included in the booklet as well. So thank you so much, and I'm looking forward to our panel discussion later. Thank you.
Thank you so much, Kimay. Knowing that 1 in 4 Canadians over 65 take at least 10 medications shows that this campaign of deprescribing is so important to creating positive, healthy outcomes for older adults. Now, physical health is a key factor in sustaining overall health, but it's far from the only factor. Ottawa RCMP shared that last year was a historic year for financial losses reported to the Canadian Anti-Fraud Centre, the CAFC. Based on the reports to the CAFC, $379 million were lost to scams and fraud in 2021, which was an increase of 130% compared to 2020. Now that more older adults and community members in general are using technology, it is apparent that we must keep our guards up and always be cautious about what we share online to maintain our financial health and well-being. We are pleased to welcome Adrian Vickery, Customer Colleague and Strategic Initiatives, North American Fraud Operations of TD Canada Trust. Adrian is responsible for fraud education, colleague engagement, and training, as well as strategic initiatives that support the evolution of TD's internal business model. Adrienne has been with TD for 30 years in a variety of different roles. Most recently, in the last 8 years, she has dedicated her career within fraud. Adrienne has a passion for supporting the communities where she works and lives. She has led the United Way Giving campaign within fraud for over 3 years. So great to have you here with us.
Thank you so much for inviting me. This is an incredibly important topic that we need to be talking about more. So I'm excited
Yes.
about the panel discussion as well.
Great.
So you've heard, there's. Can you hear me? Okay.
Yep. Yes, definitely.
Yes, perfect. So fraud can happen to anyone, as all of us know, and no matter how smart and educated, informed, and even tech savvy somebody thinks they can be, fraudsters are experts at exploiting the important part of what makes us human, and that's trust. A new TD survey for this year's Fraud Prevention Month campaign revealed more than half of Canadians polled are not talking about fraud prevention and protection with people they know, including friends and family. It also revealed that 1 in 4 Canadians polled have been targeted by fraudsters in the last year, with the most fraud happening over the phone, followed by emails and text messages. You also heard from Brenda that the Canadian Anti-Fraud Centre reports Canadians of all ages lost $379 million in scam and frauds last year, a huge increase from the year before. And to be honest, that number is much likely higher since fewer than 5% of fraud victims file a report. Do I have your attention yet? This is, what I'm going to talk to you about now is the different types, the top 3 scams that we're seeing today, and hopefully this will help educate you and sharing with others. The first is investment scams. This was the leading fraud scam, costing Canadians $163 million in 2021, reported by the Canadian Anti-Fraud Centre. In general, you want to be cautious about investment opportunities that offer high returns in a short period of time. Fraudsters will also try to apply high pressure tactics to make you act in a hurry to exploit the human fear of missing out. A good way to look at investment opportunities is that if it sounds too good to be true, it probably is. When it comes to investment scams, you can do your research before investing by verifying the investment companies are actually registered with the provincial securities agencies. The second top scam is romance scams. In 2021, the Canadian Anti-Fraud Centre reported Canadians lost $64.6 million to this scam. These scams are often start online through fake dating profiles and social media. Always be suspicious if someone professes their love for you quickly, avoids meeting you in person, and asks you for money due to an emergency. Be wary of anyone you meet on the internet. If the topic of money arises too early, it should be a red flag for you. When in doubt, do your research and share your concerns with friends and family. If they tell you your new significant other seems suspicious, it may be wise to listen. And the third top scam is our grandparent and emergency scam. This scam is near and dear to my heart. It actually happened to my mom, and I work in fraud, and I talk to her about fraud all the time. It starts with a fraudster or the grandson, or in my case, my son, calling a victim, calling the grandparent and advising them they're in trouble or in an accident and they need money immediately. The fraudster puts fear into the grandparent as they pose as the child, and he or she is begging them not to tell their parents. When in doubt, call or message the individual at the number you know that is legitimate and ask questions of the caller only the real person can actually answer. So what can you do to help protect yourself? Here's some advice. Be cautious with posting personal information online. Anything posted online can be used by fraudsters to gain the victim's trust. You want to think critically about what you're posting on the internet. Does anybody know that Facebook post about asking about your favorite things? Please don't answer these questions, because sometimes the answers to those questions are embedded in security questions for companies' login and verification tools. Number 2, practice skepticism. Approach unsolicited advice with suspicion and take time to research all your sources. Be sure not to open links and email addresses and phone numbers you do not recognize. And third, have conversations with family and friends. Fraudsters continue to adapt and evolve their approach, so it's important to continue to regularly share and discuss more openly about your experiences of receiving fraudulent calls or messages. I know many people are embarrassed that they have lost money to scams and are hesitant to share, but honestly, these fraudsters are professionals at what they do, and talking about it will only assist in stopping them. If you're unfortunate to fall victim to a scam, it is important that you report it to your financial institution as soon as possible. If you've lost money, you can also report by calling your non-emergency number for your local law enforcement. And reporting the incident to the Canadian Anti-Fraud Centre will help guide their efforts. You can help play a role in helping to stop the fraudsters. Tell everyone what you've learned here today and talk about scams as if you were in fact a victim. Thank you.
Thank you so much, Adrienne. Really essential tips for sure to keep us all safer and more protected online and otherwise. I know myself, I have seen an increase in fraudulent calls and spam calls, as sure as many have.
Thank you.
Thank you so much. Our physical and financial well-being impact how we interact within our community and society as a whole. Having access to social supports can drastically improve one's mental well-being and can make us feel better connected to our community. I would like to welcome my dear colleague, Shauna Mutton, to join us. Shauna will share some of the ways to connect to social services that may be available to you and your loved ones. Shauna is the Vice President of Community Impact at United Way Halton and Hamilton. She has a passion for the not-for-profit field, spending the majority of her career supporting her community in the sector. So nice to have you with us, Shauna.
Thanks so much, Brenda, and thanks team for not only putting this wonderful resource guide together, but for also having me today.
Yes, great. Shauna, there are so many amazing programs in our community, as you and I both know through our work. Could you share how one might find a program that they could benefit from?
Absolutely. Well, Brenda, as you know, and everyone listening, the pandemic has impacted everyone in different ways and created incredible pressure for our social safety net that is needed now more than ever. Our frontline agencies have been strained, so have those who care for not only clients, but also their loved ones, like some of you do on this call. Agencies have seen increased demand, which has led to increased wait lists for programs. And recently, half of programs reported having a wait list. Programs have had to shift to virtual or hybrid programming to ensure safety for clients and staff. And with fluctuating pandemic restrictions, program numbers have had to be reduced into smaller cohorts. Many volunteers are still hesitant, which has resulted in fewer clients being supported. At the beginning of the pandemic, 1 in 3 caregivers in Canada reported being distressed, which included feelings of anger or depression, or the inability to continue with caring activities. But along with these challenges, we have also seen incredible generosity, kindness, and compassion for our neighbors, friends, and family. So what does it mean to feel like you're part of a community? And if anyone wants to put something in the chat, feel free. Being connected to your community can drastically improve one's well-being and mental wellness. Statistics show that more than 41,000 people aged 65 or older live alone in Halton and Hamilton. And according to a StatsCan census from 2016, seniors make up 31% of the Hamilton population. This is why there are a number of programs and services designed to support older adults to stay active in their community, from meal programs to volunteering, fitness activities, and community centers. You can find something to help you fill your cup. So you may be wondering, how do I find these programs? Well, there are a number of social service tools available to help you find something close by that you may need or want to get involved with. When you want to know when to take the garbage out, you call 311. When you want to know where to go for a ride or a doctor's appointment, you call 211. Ontario 211 is a free confidential service that is available 24 hours a day, 7 days a week in over 100 different languages. It works to simplify the process of navigating health and social services by guiding callers to the information that they need. Hamilton Red Book and likewise the Halton Community Service Directory are also tools to be used when looking for programs, organizations, and services available in the community for yourself or a loved one. You can dial 211 or visit ontario211.ca whenever you need that help. As we all know, technology has evolved quickly over the last decade, leaving some finding it difficult to keep up with. On this slide and in the resource guide are some tips and tricks to stay connected to loved ones while still staying safe online. In addition to the tips shown, you can find a variety of helpful books on how to navigate technology in bookstores and in libraries. Some books are written just for older adults with simple and easy to follow instructions. With so many amazing programs in our communities, we encourage you to explore what may be available in your neighborhood. There's a friendly visiting, which allows clients to meet with volunteer community members to connect with or to chat. Assisted volunteer driving provides safe, reliable door-to-door transportation for older adults to their important medical appointments, which is powered by community volunteers who provide the service. Therapy Dogs is a group of closely screened, trained volunteers and their dogs, which visit hospitals, seniors' homes, and nursing homes on a weekly basis to support clients' well-being. Seniors for Change provides evidence-based workshops that provide healthy, promoting evidence, strategies, and access to resources. And these are just some of the programs available in your community, and you can find more in the resource guide. Throughout this guide, there are stories from older adults sharing their experiences navigating the journey of life as they face the uncertain times the pandemic brought to our doors. These stories are shared with us to observe, gain insight, and to share with others. Storytelling's power to connect us, shift perspective, and spur action wield a particularly strong influence over our attitudes and behaviors. Messages that feel like commands, even good advice coming from a friend, aren't always received well. And if someone tells you a story about the time they went through an ordeal, the information will likely come across as less like a lecture and more like a personal truth. A vivid, emotional story can make it feel more real or important. These stories are linked to the topics highlighted in the resource guide and share a personal moment of reflection. In assistance to the guide, a personal information booklet was developed to assist individuals in keeping track of their important information in the case of an emergency. This booklet is intended to be kept in a secure location, such as a safety deposit box, and its location should be shared with only your next of kin should an emergency arise, and you can no longer access your life's needs. This tool can save both yourself and your loved ones hours of searching for important documents in the event of an emergency. As this booklet will contain your confidential and personal information, it is recommended that you keep it in a secure place, as I've mentioned, in a safety deposit box or with your lawyer, and let your family know where it is located. You can get your copy of the Caring for Community Resource Guide on our United Way website at uwhh.ca/labor. It's also been posted in the chat. And you can also reach out to Labor Community Services at uwhh.ca to get a hard copy. I really appreciate the opportunity to share with you today. Thank you so much, and I look forward to the panel discussion.
Thank you so much, Shauna, for sharing those important navigation tools that anyone can use to tune into what's happening in their community and to help us all feel more connected and less isolated. So thank you very much. I would now like to welcome all of our panelists to join on the screen, and we're going to have a Q&A session. We have a diverse group of incredible attendees here today, from caregivers to service to providers to older adults themselves. Many older adults themselves, as you've heard here today, are caregivers. And in fact, Statistics Canada reported that almost 1/4 of Canadians 65 and older are caregivers themselves. So this resource is intended to not only support older adults, but those caregivers as well. So let's begin our Q&A, and Shauna, we'll begin with you. Tell us why caring for older adults creates a better community for all of us.
Thanks, Brenda. Well, with COVID impacting the ability for caregivers to support their family, it's really up to all of us to ensure that older adults in our community are getting the support that they need. And this support will reduce social isolation, improve health, and allow older adults to share their knowledge and participate in activities such as volunteerism. So this in turn, of course, is going to help to keep our community healthy.
Yeah, great. Yeah, such great insights, and you know, individual well-being and community well-being are so closely connected and tied together. Camille, from your perspective, can you share why caring for older adults creates a better and stronger community?
Yeah, so as Shauna was saying, the pandemic has struck us so hard, and what's been clearer than ever is that what people want is to be able to age safely at home, and caregivers are essential to allow that in so many ways. And they can be involved, if I'm bringing it back to medication safely, when we look at medications can help people live at home as long as possible. But if they're used in an unsafe way, if they use risky medications or too many of them, or for example, if some of them are causing dizziness and cause falls, then we're putting ourselves at risks of losing autonomy due to accidents, fractures, hospitalizations. So caregivers can be involved in making sure that the medications their loved ones are using are safe, and for older adults to thrive at home. So the tips I would give in this way to allow this to happen, or to make sure that we could put all of the chances behind us, really would be to work with a community pharmacist to make sure that regular reassessment of the medication is happening, and also that services like blister packs are considered to make sure the person can stay at home and age in place and contribute in the way that Shauna has identified to the community.
Great words, and we all want to be a part of community and contribute meaningfully, for sure. And Adrian, from what you've seen, tell us why caring for older adults creates a stronger community for all of us.
Absolutely. You know, and when I talk about scams, you know, the more we talk about it, the better, you know, the better our community is going to be. And it's not only on our older adult population to actually start those conversations, right? It's also the rest of the folks in our community to start to have that dialogue, to open up the conversation. And it is, you know, if somebody has been a victim of fraud, there's a sense of embarrassment that comes with it. And we need to reassure our older adult population and all of our population that it's okay to talk about it. These, you know, there's some shame behind it, and we need to stop that, right? We need to actually encourage people to talk about it so we can all, you know, fight the good fight against the fraudsters. They're professionals at what they do. And, you know, if we talk about it, we can actually make a little bit of a dig into that, you know, that large number that we mentioned earlier that they're taking away from our communities.
Great, Adrian. I do see some questions coming in, and we'll try to get to those shortly at the end of the session. And if we don't have time, we'll be sure to address those after. So over recent years, many of us have experienced increases in attempted fraudulent calls. We know that older adults were specific targets for these attacks because of their increased isolation. And according to the Canadian Department of Justice, approximately 10% of Canadian seniors are victims of consumer fraud each year. Based on this, Adrian, can you share what you are seeing as it relates to older adults who may be isolated?
Absolutely. We talked about I talked about romance scams earlier. To be perfectly honest, like in this environment that we've been living in for 2 years, it has accelerated because, it's natural for somebody to, they want to talk to people. We've asked them to stay in their homes and stay safe from COVID as much as humanly possible, but it has a huge draw on the mental wellness piece. So people are naturally reaching out to our social media channels. And unfortunately, with romance scams, there are fraudsters out there preying on our older population, right? On that vulnerability that of them wanting and needing that interaction. So it's so easy to fall for some of these scams. And when you talk about it, you sit there and go, oh my goodness, how could anybody fall for that? But it happens. I've seen it. I've seen some customers' life savings taken from them, and it is heart-wrenching, right? So, I would say, this pandemic has definitely increased that type of scam. Most scams, there's a lot of scams, but that one definitely comes to mind.
Yes, and especially as we know that some seniors who live in isolation, they will go days without speaking to anyone at all. And so when they do feel like someone is reaching out to them, it can become very appealing. Thank you. And so we know that more older adults are experiencing isolation as a result of the pandemic and otherwise. Isolation was an issue before the pandemic hit, and the pandemic has exacerbated that. And you will see many great community resources to support these individuals in this booklet. And with that in mind, if someone is lonely or has not received a call in a few days, they may be at higher risk of engaging with those who want to take advantage of them. So Shauna, can you tell us about what we are seeing in the community in regards to older adult isolation and how we can all support our neighbors?
Sure. Thanks, Brenda. So as we all know, we're experiencing unprecedented challenges of the COVID-19 pandemic. The outbreak of COVID-19 is going to have a long-term and profound impact on older adults' health and well-being. Social isolation and loneliness are likely to be one of the most affected health outcomes. And both are major risk factors that have been linked with poor physical and mental health status. So we can help to support by promoting social connection, mobilizing the resources from family members, community-based networks and resources, developing innovative technology-based interventions to improve social connections, and engaging in the healthcare system to begin the process of developing methods to identify social isolation and loneliness in healthcare settings. And of course, at United Way, we are continuing to advocate on behalf of the older adults in our community and investing in programming to support them. And last year, over 23,000 seniors were helped through our community investment fund. So we will continue to try and help these older adults live a better, healthier life.
That's fantastic to hear. Thank you, Shauna. We know the pandemic has exacerbated issues for older adults and increased the rate of poverty in this demographic, and those living in low income or on fixed incomes have been impacted significantly. This booklet has an incredible number of resources for those who are living on fixed incomes. And I have a question for Kamei. Can you please tell us how poverty is linked to someone being at higher risk of negative side effects of medication, and how deprescribing and how that movement aims to bolster the health and wellness of older adults?
Brenda, that's a great question, because Not everyone will be making this link in their heads, but yes, it is true that older adults who live in poorer neighborhoods are actually at higher risk of suffering from harmful effects. So in fact, older adults that live in the lowest income neighborhoods take more medications than older adults that live in the richest ones. That's the first thing that we have to take into consideration. When we look, for example, at the number of them who use 10 or more medications, it's 21% of seniors in the poorest neighborhoods. When we compare to the richest neighborhoods, it goes down to 14%. So just, we see there's quite a distinction. So when we try to explain this, it can be related to the differences in health status, really, as you've described. So Canadians who live in lowest income neighborhoods are twice as likely to report having cardiovascular chronic conditions, for example. So this is just one explanation behind that. And then I've talked briefly about the using risky medications that carry more risk of harm than benefit. Well, older adults that live in poor communities use more risky medications too, which is quite logical when we consider that they take more medications overall. So what we are trying to do really is to work on health determinants, on education, and on access to care, really, to change that, specifically looking at promoting safe use of medications. So we're working with a number of community organizations everywhere in the country to share this information, may it be through written information, but also we know that a good way to share this information would be within healthcare. So for the people to find it when they're seeking care, but also through community organizations outside of healthcare, through presentations like these ones today, and working with healthcare professionals everywhere in the country to share this information. And we're also working to equip healthcare professionals. They have to have the knowledge. They have to have to feel competent to deprescribe medications. And finally, we're working with policymakers to make sure that services that promote safe use of medications are accessible for all citizens, regardless of their income, really. So, for example, subsidized services, etc.
That's yeah, it's incredible information for sure. And thanks so much, Kim. And when we talk about mental health supports, there are several that can be found throughout this book. And the shadow pandemic of declining mental health, the secondary illness that's related to this, and the issue that's related to this is mental illness. Shauna, in your experience, how has the shadow pandemic impacted older adults' ability to access mental health programs?
Yeah, well, thanks, Brenda. Just for those of are unsure about the terminology, the shadow pandemic, of course, refers to the secondary impact of the increased bereavement, isolation, the loss of income, and fear, which is triggering mental health conditions, exacerbating existing ones. And many people may be facing increased level of alcohol and drug use, insomnia, anxiety over the last 2 years. So for older adults, specifically those that have underlying health conditions or those in long-term care, they've had to be extra cautious about socializing during the pandemic. So this includes not only social programs, but being able to visit doctors. COVID-19 patients admitted to acute care led to the cancellation of many medical and surgical services deemed non-essential at the time. So in addition, many hospital-based outpatient programs and procedures such as ECT were suspended or reduced to prevent the spread of COVID-19. So as a result, many individuals with mental health conditions in long-term care settings had mental health assessments or treatments delayed or canceled during the first 6 months of the pandemic. So now we're actually seeing this turnaround, and the support for mental health is increasing. The resource guide allows older adults to access information devoted to community emergency and crisis services, which of course includes mental health supports. So the resource guide really has all that information in there.
Thank you for that, Shauna. And, studies show that individuals living with chronic conditions are more likely to experience mental health, just as you were saying. But we know our physical health changes as we age. Many older adults find themselves living with chronic conditions. As we age, medications affect us differently, with seniors being hospitalized at a higher rate because of harmful medication effects. Kamei, do you have any advice on how individuals approach their primary healthcare provider to talk about deprescribing?
Yes, definitely. So the first thing is that you have to, it has to be important for you, and just for you as a patient to realize that we change with time. Our body changes, not always like we would like it to change, but our medication often needs to change as well. So even if a medication has been at the same dose, for the same medication, same dose for years, it hasn't caused issue. It's not a reason. It could cause issues in the future or today. So always make sure that it evolves with time, like you have evolved with time. And one of the key tips for you to talk about this really would be to talk from the heart and to share your feelings with your health professional. So asking your question with an open attitude and approaching this as we're going to do this together as a team. Things like, I feel like I'm taking a lot of medications. We call this medication burden. It's causing a burden on me in a way. Could we look at them together to make sure I still need all of them? That'd just be a simple question. Then that's if we want to look at them all. But if there is a medication that is causing specific anxiety or issue, then talk about it as well. It may be because it's causing you a side effect. Maybe it's causing you drowsiness or dry mouth, or it could also be costing you a lot of money and affecting your budget, or it also just doesn't fit in your schedule and you're just missing half of the doses. But you know what? Maybe your health professional doesn't even know about any of that. So when you tell them, you know what, I'm skipping half the doses of this medication for XYZ, maybe they'll for sure be grateful that they learned this information and will be happy to look at what they can do with you to improve the situation.
Mm-hmm. Yes, yeah, very helpful information for sure. And it's almost like your storytelling, right? You're sharing exactly what's happening in your day-to-day life. I'm going to move on to the last question. And I'm wondering, just as we wind down here, if each of you can tell us just one thing that you would like those listening to take away from today's session. And I'm wondering if, Adrian, you can start us off, please. I'm not sure. Oh,
sorry, I was on mute. The one thing here we go. The host unmuted me. Thank you. The one thing I would love for everyone to take away is, be skeptical. And if it is too good to be true, it probably is. Like really, really question what's happening to you and the questions you're being asked and the things that you're posting online. Just, be aware and share your experiences with others. Because if you're not the only one who's experienced this and talking about it is what is going to stop it in the future.
Mm-hmm. That's great. Thank you so much. And Kamei, if you could share that one piece of information.
What I would really say is really to ask about deprescribing, and you're not risking any harm by just asking, do I still need all of these medications? And if the answer is no, then yes, you still need them all, then that's okay. And when am I going to be asking this question again? Really, it's a continuous process and a continuous discussion that you should start, or if you're taking care of someone, that you could start on behalf for this person's benefit, really.
Thanks for that, Kamei. And Shauna, please share that one piece.
Just one, Brenda.
Just one.
I really like those that listening to know that we're here for you. Your United Way is here for you, and our community partners are here for you. And we're continuing to invest and promote in programming that's going to assist older adults in staying connected and living a healthier life. We see you. We're here for you.
Mm-hmm. it's really an incredible community that we live and work in, and it's been so inspiring to see, you know, how everyone has sort of rallied together in this really challenging time. So it looks like we might have time for one or two questions, and so I'm just going to look at the chat box here. I'm just going to scroll up just a second here. Here we go. So I'm scrolling just a second here. Okay. And here's a question for Kamei. How do you feel about doctors prescribing drugs without an in-person visit and over the phone? Some people are uncomfortable with that.
Yeah, excellent question. Thank you for this person asking this. So one of the main big changes in healthcare that the pandemic has brought upon us is actually increased access to telehealth. And that has many advantages actually for many individuals. It increased, so in some ways, you don't need to leave your home. You don't need to wait in a waiting room. For example, if you're at home, you can wait for a call, etc., or for a teleconference appointment. So there are many advantages. Now, telehealth needs to be used in an appropriate way, and in some cases, for some conditions, it is not optimal. We're not able to actually make a specific diagnosis, and then the health professional may need to call you in to have a further evaluation of your case. So prescribing can happen over the phone, and it can be appropriate, but if you're feeling uncomfortable with the situation, if you feel this has been too quick, etc., ask questions. That would be, if it's your regular health professional, it's a situation where it's a renewal of a medication, or it's in some cases, you won't need to specifically go in person. I don't want to go through with all of the situations, but it can be appropriate to prescribe over the phone if the health professional feels they have all of the information, or otherwise they may need to call you in. But perhaps one warning I would say is be wary of a lot of private companies now insurance companies offer access to doctors through specific private channels that are kind of siloed. Be careful, because if you're going to see a number of different doctors for different conditions, and all of the information may not be centralized, and they may not have access to your whole file. So it may be very interesting to say, oh, I can have a doctor on the line in an hour, whereas tomorrow maybe I'll need to wait until tomorrow to see my family doctor, but maybe weigh out what the situation really is, because accessing someone in an hour on the phone very quickly may not be the best care or the care you need at the time. So yes, be cautious, because we see this popping up, and we are concerned that this we don't have any data, but could increase overprescribing, that a lot of siloed care is happening this way today. So excellent question.
Yeah, it's a great question, and Kamei, thanks for that. And I'm wondering if we can ask one final question, and this is for Adrian, and we've got about 2 minutes here, 2 or 3 minutes. Are there steps someone can take to limit their personal data of being available to the public?
Yes, and I talked about this a little bit in my presentation around posting online, right? So you really need to limit posting online, really limit any clicking on any links in emails, and even sharing your passwords. We sometimes think that surely you're the only one who should know that know your PIN for your banking. So just, and I know that's difficult sometimes with the older population, right? Remembering things. Please don't write your PIN numbers down, or store it in a very safe place, as we talked about earlier, with some of that personal information. But just keeping that private is, and not sharing is what the key is to them not getting your information.
That's great, Adrian. Thank you so much, and thank you so much to all of you, Kamei, Adrian, and Shauna, for sharing your wealth of knowledge with us today. And we hope that all of you who are listening have taken away something of value. If you have a question that has not been answered, we will be reconnecting with you following this session here. And please check out the digital copy of the Caring for Community During COVID-19 booklet. And it's really intended for, yes, during this time, but beyond. The resources are there to support you beyond COVID-19 as well. And also take advantage of the complimentary personal record booklet with the links that have been posted in the chat. To request printed copies, you can visit the United Way website at uwhh.ca, or you can directly email Labor Community Services at uwhh.ca, which I think will also be posted in the chat. There are limited printed versions, but of course we have the digital versions available. And I just wanted to say, we touched on volunteership a little bit here, and just wanted to thank all of those who contributed to this incredible resource. Volunteers are the lifeblood of community and not-for-profits. And just as we close out here today, just one final message: let's continue to show our local love. That's what we say at United Way: show our local love and care for our community and for one another. Thank you so much.